So the session is called On Being Fearless. So let's talk about some of the cause, some of the reasons for that need to be fearless. I guess the first, there's so much going on right now. There's so much in the news. Right. Can you tell me what is the number one kind of biggest threat that you think Planned Parenthood faces, or the number one thing that you're most worried about?
Well, I think the number one thing in this week, so I have to every day wake up and sort of grade 8 what's going on. But obviously this healthcare bill is that we've talked about, and I hope we'll talk about today, that potentially gets voted on by the Senate on Thursday. It's not just it's sort of an existential crisis for women's health writ large. So obviously part of that is the end of access for Medicaid patients to Planned Parenthood, which would really just create an entire crisis among low-income women in this country. But there are many, many other parts of the bill that I think would just further kind of cascade the struggle that women are going to have, particularly women who are women of color, women of low income, women in different geographies. And I think the thing that is most troubling right now is, and actually we talked about this yesterday at Aspen, is at a time in which Planned Parenthood is at peak popularity. I'd say being more popular than Congress is a low bar. There's the last Quinnipiac poll said that 80% of Americans supported federal funding for the preventive services that we provide. I think the troubling thing now, and why I think you see so much angst in the countryside, is folks feel like they really have no recourse with this Congress or this administration. They just see, and again, when you see kind of bills like this just being jammed through without any public input, you have 13 white men basically in secret writing a bill that completely changes healthcare and the Medicaid program for millions of Americans. That to me is sort of coupled with the immediate problem facing Planned Parenthood. That to me is the bigger problem, is that we have a completely out of touch Congress and administration with where the American people are.
And let's break down some of the elements of that bill. So from what I understand, it defunds Planned Parenthood specifically for a year, right? And then it forbids abortion coverage by plans that are bought with taxpayer subsidies.
Right.
And separately, the Medicaid rollback, which would affect, women's ability to have Medicaid, which then they could conceivably use at Planned Parenthood or other clinics or providers. So first, which one of those provisions is would affect Planned Parenthood the most, and why?
Yeah. So first, the word defunding has been used actually by Speaker Paul Ryan to say they were going to defund Planned Parenthood. But it's really important for me that everyone understands that we are not. Planned Parenthood is not in the federal budget. As my friend Dawn Legan says, who's here, it's not like we get a big Publishers Clearinghouse sweepstakes check every year and then just go out and spend it on healthcare. Planned Parenthood operates, and we've been around 100 years, and we operate just like every other healthcare provider in the U.S., hospitals, community health centers, and that we get reimbursed for preventive services. And that also, just important to note, that federal funding, we provide safe and legal abortion. We're proud to do so. We think it's incredibly important that women have some place to go to access that service. But federal funds do not go for abortion. They haven't since the Hyde Amendment was passed. And so even though we disagree with that policy, we adhere to it just like hospitals that provide abortions. All we get reimbursed for is preventive services. So STI testing and treatment, birth control. For many women, since we're their only doctor, we do their breast exams, their pap smears, their well woman visits. And so the whole defunding is actually just taking away access to preventive services that, as we know, both do early detection of cancer and, frankly, help prevent unintended pregnancy and the need for abortion in the first place. So that is an existential threat. Again, not so much to Planned Parenthood. We will be around. But the question is, what happens to that approximately 1.6 million people, primarily women, who use Medicaid to see Planned Parenthood? That is a huge problem. But you mentioned a couple other things that I think are important, certainly in terms of, and we'll see the CBO score should come out this morning, I think, as y'all have followed. In the House bill, 23 million people were going to lose health insurance, Medicaid insurance. I saw the Brookings Institute was saying this morning that since no one actually knows how many millions it will be, they estimate, though, it will be several million people that would lose health care coverage. And then you just begin to create even a bigger crisis, which is folks that are uninsured, folks who have no place to go. And I think that we begin to see the effects absolutely right away. I think the important thing too about the abortion issue is that what they are trying to do is basically say, if you use any public subsidy to buy an insurance plan, it can't cover abortion services. And that's about 87% of the people who are, purchasing in the marketplace. So that would mean, essentially, in the marketplace, there would be no more abortion coverage in insurance plans. And I just think that's just the beginning.
So what would you have to do in that case? So that means people in the individual market, not even on Medicaid, people who make $40,000 a year would,
Absolutely.
if they got the subsidy, which they would,
Yes.
because of the law, they would not actually be allowed to buy a plan on the individual market that covered abortion. So what would they do if they wanted an abortion then?
Then they would try to have to find somebody who would see them, and they would have to put together the money.
And how much does it cost?
I mean, it depends. And I think, look, one of the most troubling things is, and I know there's a lot of conversation about women who have now complicated pregnancies that then go wrong. To have an abortion later in pregnancy, which again isn't even, it's rare. Most abortions occur early in pregnancy. It's incredibly expensive, and so now they're preventing women from even having coverage, and that can be several thousands and thousands of dollars. I think more the principle of the thing here, though, is, and look, we're going to see this morning, I know there have been a lot of rumors about what might happen at the Supreme Court today and what will happen with Justice Kennedy, but the right to safe and legal abortion itself hangs by a thread. On this Supreme Court, we have a president who's committed to who said he will only appoint nominees who want to overturn Roe versus Wade. I just think there are a whole series of things that are going to make it impossible for many women in this country. Many women, it already is impossible to access abortion safely, legally, and that's affordable. And this is just the tip of the iceberg here.
And so I wanted to circle back to one thing that you said, which is that, you brought up, and I'm glad you did, the fact that the federal funds don't actually pay for the abortions. It goes toward preventative services.
Right.
But so what I hear when I interview pro-life individuals and activists is, well, the money is fungible in some way, that if you save money in this arena, you can use it for another arena. Is that accurate, or what would you say about that?
Well, first, it's completely inaccurate, and we operate, and again, this is the entire healthcare system. I mean, you could say that about the entire healthcare system in America. Is everything fungible? Hospitals provide abortions. They provide a whole array of care. So I'm not somehow Planned Parenthood is being held to a completely different standard. And I can tell you, as an abortion provider, as a public health care provider, we are so highly regulated. I think probably the most highly regulated healthcare services in the country. And we are regularly audited. We meet every standard. So honestly, it isn't true.
So I want to hit a few more apologies for the we started on a down note, but there's just a lot going on in this space. So there's also threats to the contraceptive mandate. So
correct.
Can you describe what's going on there and how that would affect women?
So meanwhile, back at the ranch, when under the Affordable Care Act, as some of you may remember, just a few years ago, there were so many issues that we worked on to try to get equity for women, just parity on healthcare coverage. So I won't go through all of them, but certainly things like getting preventive services covered for all women. And one of the biggest fights was over birth control benefits. This was, in fact, we had to mobilize thousands of people, probably some of the people in this room, to call Congress, to call the White House, saying that this was the most basic preventive health care that women have. Young people dressing up like giant birth control packs on college campuses. And anyway, huge storm, and we finally won this incredibly important benefit. And now 55 million women in this country get their birth control at no copay insurance plans. And the reason that matters is because there are women, many women, who will forego birth control if they don't have the resources, and instead, they have to struggle with rent or food or whatever. And it's also allowed women to get the best kind of birth control, because birth control pills, quite frankly, aren't the best birth control for everyone. That is now in place.
And you're talking about IUDs, right?
I'm talking about all birth control methods. There's now 18 different kinds of birth control, and we're the experts at Planned Parenthood. We're so proud that now women can get, yes, IUDs, which are longer acting, but sometimes prohibitive, at least in the upfront cost, but over time, incredibly effective. We actually just did a clinical trial for a self-injectable Depo-Provera that lasts 3 months so that you could actually get a year's prescription, and that's a very effective method of birth control. So all of this was covered. We now have a 30-year low for unintended pregnancy in America. We have a historic all-time low for teenage pregnancy. So actually, this is working. Getting preventive care for women it's working. And parenthetically, but I think completely related, is we're at the lowest rate of abortion since Roe versus Wade was decided. So this is like we're on this huge trajectory of success in getting women access to preventive care. Now this administration has basically, there's been a leaked memo that they are now going to make it, they're going to take away this benefit. They're going to basically say bosses can now determine whether or not women get health and birth control coverage. And I think this is just going to, again, that's just the beginning. We're going to see this continue on. We have a Secretary of Health and Human Services who, frankly, does not believe in women having access to birth control. He has said he doesn't believe any woman has ever struggled to pay for birth control. We have the woman who's head of the National Family Planning Program that he appointed who actually doesn't support birth control. So we have an agency that is essentially against what is the most basic healthcare need that almost all women, more than 90% of women, need in their lifetime.
And the memo that she's referring to is, of course, the draft executive order that says that broadens the number of exemptions that employers can apply for in order to not cover birth control, right?
Correct.
Essentially.
Correct.
Okay, so that's what's happening at the national level.
That's a few things.
Just a few things. So we still have more to go. So there's also the states, which are working on their own measures and laws around Planned Parenthood and abortion in general. So 4 Planned Parenthood clinics have recently closed in Iowa thanks to a change in whether women can use family planning dollars at Planned Parenthood clinics, right?
Right.
So tell us what happened there, and are you concerned about that being a sign of what's to come in other states?
Yes, so I don't know if anyone here is from Iowa, but this is well, just kind of to put it in a broader perspective. So we see about 2.5 million patients every year, and half of our health centers are in medically underserved communities. So that can be in an urban area, but a lot of them are actually in rural or small towns in the Midwest, Iowa, Ohio, Wisconsin, Michigan, Indiana. In a lot of those areas, that's the one source of family planning that women have had. So recently, the state decided to pass a law that prohibited us from participating in the state family planning program. I can't remember the exact number, so I don't want to get them wrong, but I think we're definitely the largest participant in that program in the state, and it's now going to mean the closure at the end of this month of 4 health centers. And I was actually just talking to our center director in the Quad Cities, and she was telling me that they had just started seeing women from Illinois whose health centers had closed, and so they were the closest. In fact, they had been called by another, not a Planned Parenthood, but another place that said, we can't stay open anymore. Could you take the 1,000 women that are our patients and see them? And then another provider that had been in the Title X program, which again is very hard to participate in because it's very expensive to provide this care, had said, can you take the Title X patients? So they now had begun taking all of these other women. Mm-hmm. And now the state is saying, okay, now we're going to close you down. And so she is desperate about what is going to happen to the women in this area of Iowa, thousands of women who come to that health center every year. And this is actually what we will see happen now, is not only Planned Parenthoods, we will see other women's healthcare providers shut down. And that's what we saw in the state of Texas, where they, in an effort to defund Planned Parenthood, the state of Texas ended the women's healthcare program. 82 women's health centers shut down. Mm-hmm. The vast majority weren't even Planned Parenthood. Women went without birth control and still are going without birth control in wide swaths of Texas, which is an extremely, as you know, large state with a lot of rural populations. And we've now begun to document what's happened. Not only have women lost access to family planning services, they've now kicked us out of the breast health program so that we can't see women who are coming to us for early screenings of breast cancer. We have been kicked out of the HIV/AIDS prevention program, and we know what's happened in other states where then there's epidemic. And as many of you may know, the state of Texas now has doubled their maternal mortality rate. And this is predominantly, and our majority of women affected are women of color who have less access to preventive health care. And I'm just telling you, so we were the canary in the coal mine in Texas, but I think what we're going to see now is state after state after state in this sort of putting politics ahead of women's health care. It is going to have dramatic impact on women and their families. Because if a woman can't get access to health care, the cascading impact on her children and on her community is enormous.
So just, I mean, again, we don't have a pro-life person up here, but you know, the thing
and can I just say, I really don't like that word pro-life, because I consider myself to be pro-life. I work every single day for the life and well-being of women. And I just think it's a complete misnomer. These are people who are against access to safe and legal abortion. That is their right, but that's what they are. They are not pro-life.
But usually when you talk to them, they'll say, well, of course, you know, these Planned Parenthoods will shut down, but other clinics, you know, other than for the abortion services, other clinics can take in these women. They can provide the, you know, cancer screenings, provide birth control, what have you. What's sort of the argument against that?
Well, that actually every medical association, including the American Medical Association, local community health centers, federally qualified health centers have said, we cannot possibly absorb the 2.5 million patients that Planned Parenthood sees. Look, I have learned this over my years at Planned Parenthood. We see it predominantly, we see young, low-income women. 75% of our patients live at about 150% of poverty or below. And again, for many of them, we are the only place that they can get access to affordable health care. So that's one thing. Like, they should listen to the healthcare community. They're just, you know, they're sort of making up their own spin here. And the other thing that is really troubling, and again, I think our friends in the community health system would say it, including here in Colorado, some folks I've talked to, is that if you've got a Medicaid card and if you've got a lump in your breast and you're trying to find someone to see you, it could be a month, it could be a 2-month wait. And I'm sorry, there is no woman in America with a lump in her breast should wait more than a day or two to go be able to see a doctor. That's just outrageous to me. I can tell you patient story after patient story of women who said, like woman in Dallas, Dana Ferris Fisher, she had lost her insurance. I mean, this is a Harvard grad. She and her husband had moved to Dallas. He lost his job. So they lost their health insurance. She found a lump in her breast. She literally could not find anyone to see her in a timely fashion. And finally someone said, well, maybe you could go to Planned Parenthood. She went to Planned Parenthood, and because of Vivian, the clinician there, she not only saw her, helped her, you know, basically said, we've got to get you in now for a mammogram. She got her into treatment and then saw her all the way through her treatment. And Dana Ferris Fisher now she's working for American Airlines. She's cancer-free. She said she would not be alive today if it hadn't been able to go to Planned Parenthood. That's the safety net in America. And essentially this bill and all of this sort of putting politics in between women and healthcare is going to destroy the safety net in this country. And the last thing I'll say is we serve a lot of people with birth control, a lot of young people. And I don't know about you guys, I have 3 kids. If a young woman in particular wants to get birth control and calls up someplace and they say, well, we can see you in a couple of months, I'm sorry. That's just not going to work. I mean, that's the difference between an unintended pregnancy and not. And so we're really proud of Planned Parenthood to be doing same-day appointments, next-day appointments. Last year we just hit like 2 million appointments on mobile phones, and that means if you're a young person at 2 a.m. and birth control might just be on your mind, that you don't have to wait and try to stand in line at a public health care center. You can text us and say, I need to come in and get birth control, and we will see you. That's what the public health care promise should be about in America, and that's why our motto at Planned Parenthood is care no matter what. It really matters.
So since the whole women's health decision at the Supreme Court level, so a lot of clinics closed down in Texas. This is the
Yes.
hallway widths and the admitting privileges thing in Texas, and then it was, the Supreme Court decided that was an undue burden.
Right.
So has it been easier for, I know that was whole women's health, but have clinics been able to reopen in Texas since that happened?
Absolutely. No, it's a great question. And again, Texas is my home, so I probably follow it a little more closely. But look, dozens of healthcare providers shut down in Texas, and it's very hard. Planned Parenthood is a brand name. Planned Parenthood is a respected provider. 1 in 5 women have come to us. So in some ways, it has been easier for us to begin to reopen. We just reopened abortion services in Waco, Texas, my hometown, which has been really important. We've reopened some clinics in East Texas. But I cannot tell you how disruptive it is for women for their local healthcare provider to shut down, because even at Planned Parenthood, you can't just turn around the next day and completely rebuild a healthcare staff, a building, everything, the licensing and everything you need. And that is my fear, is what's going to happen here is, it's taken us 100 years to build a healthcare system for women in this country. And this move by Congress and the president could basically erase that progress really overnight. So we're proud of what we've done, and we will fight to keep our doors open everywhere we can, but the disruption for millions of folks is it's gonna be serious.
And you've been doing this for how long? Since 2006, right?
That's right.
Okay.
That's why I look so old.
No.
In dog years, I think that's like 77 years or something.
So even, maybe since that time or even before then, has the rhetoric around abortion always been this toxic and this polarizing, or has it ever been less, intense? I don't know. Has it gotten worse over time?
Well, I think the rhetoric has always been probably tough, but I think two things have fundamentally changed. One is there was a time when the Republican Party embraced kind of individual liberties and kind of government stay out of my personal business. And in fact, many of our Planned Parenthood affiliates were founded by Republicans, like the Goldwaters in Arizona. And I remember when the Bush, Bush Sr., a big supporter of Planned Parenthood. Unfortunately, I believe just as the sort of more extreme elements of the Republican Party have taken hold of the primary apparatus, that it's just become very toxic politically. We used to have a ton of pro-choice Republicans in the United States Senate. Now, pretty much holding on to Susan Collins and Lisa Murkowski. So if you get a chance, please thank them for being such stalwart supporters of women's health. But the other thing that's happened, and I think this is important when we talk about the disconnect with Congress, is the vast majority of people in this country believe that abortion should be safe and legal. And it's actually, that's even more true today than it's ever been. And I think this is, and it kind of goes back to your using the word pro-life, because I just think it masks actually a much more complex topic. Abortion is a very personal issue. And there's very few families in this country that haven't had to deal with, thinking about a pregnancy or what to do around a troubled pregnancy. And so I think when we use these sort of political binary terms of pro-choice, pro-life, it just doesn't reflect where people are. And I learned this early on when the state of Mississippi tried to ban legal abortion, and the legislature passed a ban, and then they took it to the ballot for the people of Mississippi. Now, if you polled in Mississippi, it would absolutely, I'm sure, poll that it's a pro-life state, and folks will say, well, there's no way to actually deal with this. But folks actually begin to talk and go door to door and speak to religious leaders, and at the end of the day, that abortion ban was overwhelmingly defeated by the voters of Mississippi. And it was because there are people in this country can be very empathetic, and there might be a situation where they say, like, I would never have an abortion myself, or that's not the choice I would hope my daughter or whoever would make, but I don't want to make that decision for every other woman. I can't walk in her shoes. And I think that's really important to understand, because essentially what this administration is saying and what this Congress is saying is, instead of women being able to make their own decisions about their pregnancies with their doctors or their religious, whoever they want to consult. We're saying instead of women being able to make these decisions that are deeply personal, we're going to put it in the hands of politicians. And that is just not what the American people want.
Have you ever successfily persuaded someone to come over from the, whatever you want to call them, pro-life, anti-choice, whatever your preferred term is? Has someone ever been staunchly against abortion, and some conversation that you had with them, something that you said to them, changed their mind?
I don't think it's so what I said. I don't think it's words, it's people's lived experience. Oh. It's been people who have then faced an unintended pregnancy. I will tell you, there have been people who picketed outside Planned Parenthood and showed up on our doorstep one day.
Really?
And just said, this happened. It's been members of Congress or politicians who finally have come and visited a Planned Parenthood health center and seen the incredible health care that we provide and how grateful our patients are for that care. So I think it's through people's lived experience. I don't think it's through rhetoric. I don't think it's through language. I think it's through people beginning to have compassion and empathy for women and people in this country. That's how I think change happens.
So the staunchest argument that I hear from that side, and also actually the most frequent argument, is, well, because they really do. They believe that it's murder. So I mean, that's what they believe. But the thing that they say is, well, why can't the woman just carry the pregnancy to term and give the baby up for adoption? What do you say to people who say that?
I just believe that that's a woman's, I don't know if that's ever been said by someone who's actually carried a pregnancy to term. I've carried a few myself. And the thought that the state would say to women, regardless of your circumstances, you're going to carry that pregnancy no matter what. And that's what they say. We're not talking about carrying a pregnancy to term in some kind of Gerber baby ad. Women have to make all kinds of tough decisions about pregnancy. And the thought that the state would make that decision instead of a woman is, I think it's wrong. And I think it is incredibly important that women not only maintain this right, but that we fight for it. And I can't imagine anyone who's ever, well, I will just say, again, having been pregnant myself, my children are the joy of my life, but that was my decision to make. And I'll fight till the end of my days for every woman to make that decision herself as well.
So let's talk about what people, people who support Planned Parenthood and support you and your cause, what can they do in this time when you have a Republican majority in Congress, you have a Republican president? What can people be doing on the ground if they want to be activists in this area?
Well, I think we're already seeing it. And again, the Women's March was just the beginning. I think that did not happen, by chance. I think that women are desperately concerned about the erosion of their rights in this country, and not just women, but men. And so one thing I think is really important to talk about is men, we need more men on the field. It's interesting right now in this fight over the Affordable Care Act repeal and all these efforts to undo access to Planned Parenthood. One of the reports was of the most commonly used app to phone Congress is that 86% of the calls coming into Congress in opposition to this bill are coming from women. So men, we need you to step up and help us out, because this is not only a women's issue. This is an issue for everybody in this country. And so for any man in this room who cares about your opportunities for your daughter or your wife or your sister or your granddaughter, this is the time to speak up and speak out. We need that very much. And then I think that we have got to work to hold our elected officials accountable. This bill, right now, obviously, as we've talked about, this is only one thing in a series of things that are potentially going to happen to women. But this bill is going to be decided by a handful of senators. And so everybody in this room needs to call their senator or call their congressperson if they're concerned about this. That is, people ask if it makes a difference. It's the only thing that makes a difference. It is the only thing that makes a difference. And there are folks that are absolutely right now, I think, on the bubble, as we say, trying to make a decision about whether they will vote to support this bill or not. So making calls really matters. And then, but as I say, marching is great. Knitting pink pussy hats is great. Showing up at town hall meetings is great. Voting, that's the whole thing. If we don't vote, we get the government that someone else votes for. And unfortunately, that's a large part of what happened in this election. Millions and millions and millions of people didn't vote.
Do you, so I want to talk about the future a little bit, and
okay.
So there's, what are the odds that as we go forward we might have either over-the-counter birth control pills, or even for abortion that people could maybe order the medication abortion pills
Yep.
by mail, and just kind of if it's really so difficult to access, just
right.
Take it into their own hands in a way that's not dangerous necessarily.
Right. I do think. Look, this is the crazy thing, is I feel like we're living in a world in which there's so much disruption and opportunity, and I know that's a lot of what I'm sure will be talked about at the Ideas Fest this week, but there are some things that even politics can't stop, and that is like of all the things that Congress is doing, they can't uninvent the internet. That's I firmly believe, and so even today, as they're trying to shut down sex education programs, we see more than 6 million visitors every month online at Planned Parenthood that can get access to, high quality sex education information in English and in Spanish. They can type in their zip code. They can find a Planned Parenthood health center. We're now doing birth control actually online in some states. In fact, we just, one of our first success stories was a woman who lived 500 miles from the closest clinic. She did a video conference with a clinician, and then we were able to drop ship on a float plane birth control to her up in the Arctic. And that to me, so that's my idea, right? Is that we're just going to be, and I would love to partner with Amazon and Jeff Bezos to now just have drones delivering birth control everywhere. That's what's going to happen. Yeah. I mean, and again, I really hope birth control goes out over the counter. I don't have a lot of hopes with this Congress, but I do think that we are finding more ways to do that. Even medication abortion, for those of you who don't know, this is a birth control pill that is a highly effective method of terminating a pregnancy very early, very safe, very private. We've been doing telemedicine, being able to help women who don't live near where there is an access to a provider to basically have a video consult with a doctor, where then locally a clinician can provide them the medication. I hope we go that direction more than women just doing it on their own, but as we know, millions of women every year around the globe do take measures into their own hands. Mm-hmm. I think it's incredibly important that we keep women safe and provide them that access. But I do think that's what's going to happen. We've been doing a program that I love, and again, I think if we had the right kind of attitude with the government, we could really expand, which is we do text chat with young people all the time now. I think last month we did more than 25,000. These are young people, and maybe you can kind of imagine what it's like to be back in your teens and you can't talk to your mom, or you're afraid to, ask your friend who knows less than you do. But we text with young people. I remember a young woman texted the other night, and she said, I'm a young teenager, I'm helpless and really scared. And at the other end, we were able to text back, well, we're here at Planned Parenthood, we're here to help you, and tell us your situation. And we texted back and forth with her, and the truth is she was in a really tough spot, and we determined that she needed to see a doctor immediately. And so as we end the text, again, all of this by text, never having to pick up the phone and get those words out of what was going on for her. At the end of the text, our clinician texted back, as we always do you have everything you need? And she texts back, just like a young teenager would, you have been a lifesaver, with a little smiley face emoticon. But then a couple of minutes she texted back and said, but will you still be there later tonight if I need you? That is why we're here, right? And that is, that's the kind of care that we need to be providing for young people in this country who are trying to do the very best they can, sometimes in a very, very difficult situation. And so when I think about the future, obviously with this really challenging political environment, I think us at Planned Parenthood, we're just trying to think of more ways to not only be disruptive, but to reduce barriers for folks who have the least access to care. And so when I think about that, I think about a young teenager, maybe from my own hometown in Waco, Texas, just really trying to figure out and make a hard decision maybe, and that we need to be there for them.
Okay, well, I think we're going to take some questions from the audience, and I just ask that you start with your question. There's going to be mic runners that come to you, but start with your question rather than a statement, so we can get more of them in. Over there?
We have one here in the middle.
Oh.
Could you stand up, please?
Oh, please. Cecile, hi. Hi, my name is Lisa Kopecki, and I live in San Antonio, Texas.
Hi.
And your mom, so proud of you. So, thank you. On my way to my acupuncturist about twice a week, I drive by the medical school, and there's Planned Parenthood. Y'all have a facility, and there are so many picketers, mostly men, during the week.
Yeah.
So, anyway, and mostly men, and a lot. And how, if you're a young girl,
Right.
or even any woman, go through all those picketers when you're scared to death.
Right.
And I think about it, Cecile, I think about it a lot.
Yeah.
And it just, so how do you all address that?
Yeah. I think everybody, I don't know, can all y'all hear? Okay, I wasn't sure how good the mic is. No, I mean, it's just incredible to me that in this day and time, what women have to go through. I'll never forget, I was with Kathleen Sebelius, the former Secretary of HHS, but before that, when she was governor of Kansas, we had an event, and there were these, it was really ugly, just ugly protesters outside for this beautiful Planned Parenthood event. And I was thinking, oh my God, I'm so worried because the governor is coming and she's going to see what these really just ugly folk. And Kathleen got in and she said to the crowd, I'm really glad you had to walk through that protest line to get in here tonight, because now you know what women in America deal with every single day just to access health care. And it is outrageous. And we have, so I guess the two things I would say is one, when people say how hard is, how do you keep doing this job? It's like, I get up every day, and thank God for the clinicians and the doctors who walk through those lines every day and open up their doors to provide health care to women no matter what's going on. They're some of the most courageous people I've ever had the honor to serve with. And then we have volunteers all across the country who help escort women and try to provide safe access. And increasingly, we have found ways, I hope, to build health centers, including the one in San Antonio, which is incredibly beautiful, a really welcoming space, but that provides folks, when they get inside Planned Parenthood, they feel safe, they feel welcomed, and they feel taken care of. Yeah.
Hi, thanks so much. I'm Emma Green, I'm a journalist with The Atlantic. So throughout this presentation, you've talked about the vulnerabilities that your organization has being targeted by state and federal government based on some of the services you provide. And it's my understanding that a lot of the objections that come from these legislators are based on the abortion services that you provide. So why not spin off the abortion services that Planned Parenthood provides into a separate organization to leave the gynecological services less vulnerable to attacks from legislators?
Well, first of all, abortion services are gynecological services and they are healthcare services. And it's really important to us that we not do anything to further stigmatize women who make this decision and who need access to safe and legal abortion. So we will not divide up our organization. But I also just want to, I'm going to just a cautionary tale. These folks aren't just against Planned Parenthood and they're not just against safe and legal abortion. They're against birth control access. This is what you have to wrap your head around. For anyone who thinks that somehow that, well, if we just didn't provide abortion services, that somehow they would quit this attack on women, I'm sorry. It's just the beginning. And I think it's more important than ever that we stand loud and proud for the ability of every woman, regardless of her income, her geography, her immigration status, her sexuality, her sexual orientation, to access the full range of reproductive health care. And the minute we begin to edge back from that is the minute that they've won. So I do think this is a really important time. And look, I think we at Planned Parenthood have been dealing with the stigma of abortion, particularly in these last 10 years. And I really want to shout out the reproductive justice community that has been in the forefront of saying we've got to quit apologizing or hiding. And it's amazing to me, the women I'm seeing now, some women in their 70s and 80s coming forward and telling stories they have never told in their life before. We now have women's magazines, and I got to shout out Teen Vogue and Cosmo, Glamour, women's magazines that are putting abortion stories into their magazines. That's never happened before. Shonda Rhimes, who just joined our board, the most important, I think, TV person in Hollywood, having on Scandal, one of the most highly rated shows, having an abortion dealt with not in hysterical terms, and as a matter of fact about Olivia Pope's life. We've got to just, pull the curtains back and be open and honest about a procedure that 1 in 3 women in this country will have at some point in their lifetime, and their right to make that decision.
Hi, Cecile.
Hi.
I'm Lisa Smith. Thank you for everything you do. You provide, and Planned Parenthood provides, extraordinarily important services for survivors of sexual violence and domestic violence, and those are 2 issues that haven't come up in the conversation, but you're really on the front lines of that, so I wanted to just put that on the table and ask you to speak to that.
Yep, it's really important, and I mean, again, this is one of the reasons we've been fighting so hard about the whole, women, the whole issue of women being able to get insurance, because in the past, women were prevented from getting health insurance because they had been the victim or survivor of a sexual assault. And so that's really important in the big scheme of things, that there are reasons in which women have been blocked from care before. We got to be really serious about. And also, it's interesting that you bring this up, because Iowa is a state in which we have partnered for years to be a source of for women who have survived sexual assault, who don't want to go to their local emergency room. They can come to Planned Parenthood, and we work with law enforcement to ensure that women have a place to go where they feel safe and taken care of. And I fear that that's going to go away in many areas. And as we know, this is an issue that continues to this day. Women do not feel safe in many of their communities to report their assault to the police or to deal with an emergency room not knowing who's going to be there. It's something we have to continue to work on. And again, it affects so many vulnerable populations disproportionately, and it's a really important issue. Thanks for your work. Sorry, this feels like it's been such a bummer. So if anyone wants to ask something.
About the taco truck, perhaps?
Yeah, that's a whole nother thing, but anyway.
I have a question right here. Could you stand up, please, and state your name? Thanks.
Good morning, I'm Helen Meyer, and I want to ask you about your legal strategies going forward.
Yeah.
Who are your important partners, and how effective have those partnerships been?
Yeah, so we have I often say that if the Planned Parenthood offices caught on fire, I would take our head of litigation in a backpack and carry her out, because I feel like our litigation team is like the crown jewel of Planned Parenthood. They do such phenomenal work, and there are 3 groups that really work in this arena: the Center for Reproductive Rights, the ACLU, and Planned Parenthood. And we are like a trifecta, unlike any other, I think, area of our work. So I feel we have a very good partnership. It is really the most competitive job, I think, in our organization is to go work for our litigation department. We just get the cream of the crop. And in addition, we have extraordinary partnership of pro bono law firms. And so we are always prepared to litigate. I think we're now in more federal courtrooms than we've ever been in our history. But our first goal is not to get to court. Our first goal is to beat things, and particularly this bill. I mean, obviously, if we have to litigate, we will do that. But it's more important to us than ever that we stay out of litigation, because that's kind of the last frontier. But I just can't say enough about. Well, if I began to list all the law firms that have helped us, we'd be here all day. They've been phenomenal. And the outpouring of support particularly of lawyers that want to be in this fight with us. So I feel really good about it. And thank you to everybody. And some of you here are financial supporters of Planned Parenthood. Many people contribute to our litigation work, and it's incredibly effective and important.
Good morning,
Hi.
Cecile, Olga. Avery Blank. I'm one of the scholars to have the opportunity to attend, thanks to the patrons.
Okay.
I wanted to ask, for someone who is interested in running for elected office,
Do it.
in a swing county who's pro-life, but who has constituents who are more moderate and even some conservative, what's your advice for the political realm of helping to win over or get the support of others who may not share some of the views that you've expressed?
Yeah. I think, I'm not sure if I completely understand your question, but I guess I will say, I think there's a difference between how you personally feel and what you would do in a circumstance and make a decision and what you think government should do. And so, again, I think there are a lot of people in office who may have, again, have their own deeply held personal views, but who recognize that government shouldn't be in the role of making those decisions for all women. And so I just think that's an important thing to really think about. And I do see a lot of politicians who can hold these two thoughts in their head. And I also think that one of the things we haven't talked about is people sometimes ask, okay, well, where's the common ground in this country? And to me, the common ground is helping young people get access to medically accurate sex education that helps them prevent an unintended pregnancy, be able to finish school if they want to, and sort of live their dreams. And I have yet to meet a parent in my 11 years at Planned Parenthood who was excited about their teenager getting pregnant before they finished school. And so I just think we have to recognize that there is a lot of work we have to do as a country. We're making progress, but not near enough. And that's work that, frankly, I think we should do together. I think the fact that every woman should have access to birth control that's affordable or that is at no cost to prevent unintended pregnancy. And then we need to do a lot better about helping any woman who wants to have a pregnancy get high quality prenatal care, be able to have good maternity benefits. 13 million women are about to lose their maternity benefits under this bill. So we need to make sure they get good prenatal care, good maternity benefits, and then can raise a child that is healthy and that is safe. We do a terrible job in this country. I mean, there's a lot of people who obsess with the child before it's born and then completely abandon them as soon as they're here. And I think we just have to be honest about that. I mean, this is the crazy thing about this bill to me. It's like, no matter where you are in the political spectrum, this bill makes it much harder to prevent an unintended pregnancy, much harder to have a healthy pregnancy, and then once, by cutting children off health care coverage, et cetera, makes it much harder to raise a healthy child. This is just incompatible with, I think, where we should be as a country.
Hi, Laura Berchthold.
Hey, Laura.
Hi. So we're here to hear you talk about being fearless. And in the face of these giant fights, I actually think of you as badass. And I'd like you to talk a little bit about who and what you draw on to be badass and how we can all be a little bit of that.
Yeah. Look, I think everyone's trying to be a little more badass these days. And just realize that whatever we have been doing, it's not enough, and we have to do more, and that looks different probably for every person. But I do think that I am an incredibly privileged person. I have been my entire life. I have always had the ability to work in a job that gave me great a feeling of being able to make a difference, small or sometimes bigger. That's a privilege that very few people in this country have. So my job isn't hard. And I feel like every day that we get up and open our doors at Planned Parenthood, that means approximately 8,118 people, I did the math, receive health care. And many of them, if we weren't there, they wouldn't get that health care. That's what keeps me going. And I think that in these moments, can I tell you one quick story for time? Okay, I know where the timekeeper is. I'll tell you really. So I was someone raising their hand? Are you?
You're fine.
Okay, we're fine. All right. Really quickly, because I think about that young teenager texting us, but I also think about a woman who, in the last presidential election, not this one with Hillary, but in President Obama's re-election, that was a very close election. If people remember that, like in the early part, it was like, and I remember going into the fall, and the president hadn't done well in the first debate. The second debate was really important, and I remember I was there at the debate, and like right off the bat, President Obama said, well, one thing that differentiates me and my opponent, Governor Romney, is that I support Planned Parenthood, I support the life-saving work they do, and he wants to shut them down, because that's actually what Mitt Romney had said in that campaign. And I was like, oh my God, we've never been the topic of a presidential debate. That's incredible. And then he said it actually 3 more times. Not that I was counting, but I was. And so it was obviously a huge thing. It was before 70 million voters. And of course, he went on to have the biggest gender gap of any presidential candidate in history. And so it was a defining issue. But here's the reason it mattered. 2 days after that debate, a woman came into our health center in Houston, Texas, on the Gulf Coast Freeway. And because she had found a lump in her breast, and the clinician said, I'm really glad you came to see us. The woman didn't have a doctor, hadn't been to a doctor in years. She said, we can take you right away, but can I ask who referred you? And she said, well, I heard President Obama say on TV the other night that you do breast exams, and that's why I'm here. And I'm like, so that's why we're here. That's why I'm here. And so I guess that's what, if being a badass means getting up every day and fighting for a woman in Houston or a teenager who's scared out there looking for somebody or someone who can just give them some help, it makes it really easy to do this work. And never been prouder to be with an organization.
Hi, my name's Howard Gilbert, and I think I'm the first male who has spoken here.
Thank you, Howard. Thank you.
We have a very vocal minority that has had an excessive influence on our political process. And you have a somewhat vocal, but much less vocal majority, and you have a great story to tell. The challenge, it seems, is how do you get this majority to tell your very empathetic, terrific story, to put pressure on the political people who are involved? And you have a great story to tell. I think you can do this. The challenge is just how. And I'd appreciate your comments.
Yeah, thank you very much for that. And I guess it is hard to get good news in the media. I mean, and I think right now, it's such a crazy environment. Like, I mean, how many of you knew that we were literally at the lowest rate of teen pregnancy in our entire history? Okay, well, that's probably about 90% more than usual. I mean, it's very hard to get the success stories out there. And the other thing that's very hard is that when you talk about women and women's stories and women's lived experience, and particularly women of color, we're not covered in the news. And so I feel like the one thing we have tried to do, but we have to continue to do more of, is use other disruptive means to lift up stories that never are going to make it on the front page of the local paper. And we need more women in the media, frankly. We need more women on TV, because we are at a complete imbalance. And obviously, we need more people in Congress who could get pregnant, because then we could quit fighting about birth control and Planned Parenthood. So I just think that inequity, not only in terms of gender, but in terms of race, is really a problem. That's why it's exciting to me, and I see all these young people now who are literally on the front lines, and we're doing everything we can to lift their stories up, because to me, they're the face of the future, and they're the folks who are the change agents in this country. So I think we all have to continue to think of ways in which we can lift up the stories of people that are not being told, and certainly not being heard in this Congress. I guess the last thing I'd say is, as frustrating as it is, there's a reason why we have 80% support in this country for Planned Parenthood. And that's because most people in this country actually know what Planned Parenthood does, and they respect the fact that there is a place that folks can go to for affordable health care in this country. So we have to lean into that, as they say, and not let the fact that Congress is really sort of disproportionately unrepresentative of the vast majority of the country shut us down. Again, I don't think change in this country is not going to come from Washington. It's going to come from Nevada and Arizona and Colorado and Michigan and places where people are choosing to organize, self-organize, run for office, show up in town hall meetings. That to me is when we're going to actually take our democracy back. But we got to keep trying. We got to keep trying. So.
I think we have time for one more question.
Yeah, thank you. My name is Barbara Lee, and I'm wondering if we want to support financially Planned Parenthood, if you can describe the difference between giving to national and giving at the local level and the local healthcare centers.
Sure, absolutely. So thanks for being a supporter. To anyone who supports Planned Parenthood, one of the most exciting things actually since this election, well, I mean, so many crazy things happened. That, I think you probably know that the week after the election, we had like a 900% spike in folks trying to get an IUD at Planned Parenthood because young women were worried that they were going to lose their birth control benefit, and then they wanted one that would last all the 4 years of the administration. That care, and then we had actually, I think we've had more than 600,000 new financial supporters and they are mainly young people. And that is really exciting, because to me that shows that this is like the vibrancy of what we're doing and what we need to do. But to your direct question, it's really important. The money you give locally helps provide direct services, and folks need you like never before. So no matter where you live, there's a Planned Parenthood, I can guarantee you. And if you don't know where it is, go on our website and type in your zip code and you'll find it. They would love your support, and that's really important. The national organization, we don't get any public funding, so we don't have to, we're not dealing with that disruption. We use our resources to litigate, to run this campaign to fight against Congress's defunding. And then we do other things to support, particularly our affiliates that are struggling. So we just actually did a major project to expand healthcare access in the Deep South. If anyone, you go to New Orleans, please go by our new Claiborne Avenue Health Center. But that's really what we do at the national organization, is try to support our footprint all across the country. But I guess at this moment, I would say to anybody who has extra shekels to give and wants to be supportive, support your local Planned Parenthood. They need you. They need you not just financially, they need you emotionally. This is very tough work. And maybe I'll just close with this, because that was our last question. When I talked to the director in Quad Cities, Iowa, this week because I called her to say thank you for what you all are doing, because they're continuing to kind of run through the clock here. They're going to close at the end of June. She's going to lose her job. They're all going to lose their jobs. And she said, I just want to tell you something. I talked to the staff once we found out that we'd been kicked out of the family planning program. And I said to them, look, I understand, these jobs aren't going to continue. And so you all should just feel free to stay or go. And she said, every single employee said, oh, no, we're staying. This is the most important place that we could be. And she said, and that's how I feel too. And she said, I've been here, she's been there more than 10 years. And she said, even knowing what I know now about what's happening politically, she said, I wouldn't take any of it back. And she says, I may be out of a job for a while, but the care that we've delivered here in the Quad Cities is so important to me. It's the proudest work I've ever done. So thanks for what you do to support us, to support women, to be badasses, and to be part of the resistance. I appreciate it. Anyway.
Thanks everyone for being here.